This podcast is for educational purposes only. It is not medical advice. Always consult with a qualified healthcare provider before starting or stopping any supplement, peptide, or treatment. Individual results may vary. Substance P is one of the most fascinating and powerful neuropeptides in the human body. It's a key player in how our bodies sense and respond to pain, inflammation, and even emotional states. Its discovery dates back to 1931, and ever since then, research has slowly peeled back the layers of how it works. What makes Substance P so interesting is that it's both a messenger and an amplifier. It doesn't just send a signal. It can turn the volume up on how intensely your body reacts to pain or stress. Substance P is part of the tachykinin neuropeptide family. It's made up of 11 amino acids and acts mainly through the neurokinin 1 receptor, often referred to as the NK1 receptor. When it binds to this receptor, a cascade of events is triggered that can affect blood vessels, immune cells, and the central nervous system. One of its primary roles is transmitting pain signals from the peripheral nervous system to the central nervous system. This means when you get injured, Substance P is often part of what makes that pain feel sharp, intense, and immediate. But Substance P isn't only about pain. It's deeply involved in inflammation. When Substance P is released, it can make blood vessels dilate. This increases blood flow to tissues. It can also make capillaries more permeable, which allows immune cells to rush to the site of injury or infection. This is one of the reasons why areas with inflammation may look red, feel hot, or swell. Substance P helps coordinate that response. In the brain, Substance P has been linked to mood regulation. It interacts with brain regions involved in stress, anxiety, and depression. In fact, several experimental treatments for depression have focused on blocking the NK1 receptor. The idea behind this is that too much Substance P activity might amplify negative emotional states. Some research suggests that balancing Substance P could support more stable mood regulation, reduce anxiety, and even help with sleep quality. Substance P also has important roles in the gastrointestinal system. It's found in high concentrations in the gut, where it helps regulate smooth muscle contractions, intestinal inflammation, and gut-brain communication. When Substance P levels are too high, it's been linked to conditions like irritable bowel syndrome and inflammatory bowel disease. When levels are balanced, it plays a role in maintaining normal gut function. One of the most intriguing areas of research on Substance P relates to its impact on pain sensitivity and chronic pain conditions. In people with fibromyalgia, migraines, neuropathy, or chronic inflammation, elevated levels of Substance P have been documented. These elevated levels can make the nervous system hypersensitive, meaning normal sensations can feel painful. By modulating Substance P, scientists believe it may be possible to turn down the intensity of chronic pain. There's also growing interest in how Substance P interacts with the immune system. It doesn't just respond to inflammation. It can actually activate immune cells like mast cells, leading them to release histamine and other inflammatory mediators. This means Substance P can be part of a feedback loop, making inflammation stronger if it's not regulated. On the flip side, Substance P can also play a protective role. It can promote healing, tissue regeneration, and nerve repair. In certain injury models, Substance P has been shown to stimulate the growth of new blood vessels, help repair nerve damage, and accelerate wound healing. This duality makes it both a friend and a foe, depending on the context. Because of its wide range of actions, substance P has become a target for potential therapeutic interventions. Researchers are exploring both ways to block it and ways to use it therapeutically. Blocking substance P or its receptor is being studied for chronic pain conditions, migraines, inflammatory diseases, and mood disorders. On the other hand, delivering or stimulating substance P in controlled ways is being explored to accelerate healing and support nerve repair. Substance P is also involved in respiratory health. It can influence the contraction of airway smooth muscles and contribute to inflammation in the lungs. In some respiratory conditions, substance P levels are elevated, and that can worsen symptoms like airway hyperreactivity. This is part of why NK1 receptor antagonists are being studied for conditions like asthma and chronic bronchitis. In the cardiovascular system, substance P can act as a vasodilator. This means it helps open up blood vessels, which can lower blood pressure in certain contexts. But when overactive, it can also contribute to pathological inflammation in blood vessel walls. So once again, balance is key. One interesting aspect of substance P is how it interacts with stress. Under chronic stress, substance P levels can rise significantly. This can lead to increased pain sensitivity, worsened inflammation, and amplified emotional stress. This may be one reason why chronic stress can worsen many physical conditions. Regulating substance P activity might be one of the ways the body could return to a more balanced state. In the skin, substance P plays a role in itch, redness, and local inflammatory reactions. Conditions like psoriasis, eczema, and neurogenic inflammation have all been linked to substance P activity. In dermatology research, targeting substance P has been explored as a way to reduce itch and calm inflammation in chronic skin conditions. Substance P's influence also extends to the central nervous system and neurodegenerative processes. Some studies suggest that elevated substance P may contribute to neuroinflammation, which can worsen conditions like multiple sclerosis or Alzheimer's disease. At the same time, there's evidence that controlled activation of substance P pathways can support nerve regeneration after injury. Animal studies have shown that blocking NK1 receptors can reduce anxiety-like behavior, suggesting that overactive substance P signaling might amplify fear or anxiety responses. This has led to experimental use of NK1 receptor antagonists in psychiatric research, though results have been mixed and depend heavily on individual biology. Substance P also interacts with other neurotransmitters, including serotonin, dopamine, and glutamate. This means it doesn't work in isolation. It's part of a larger network that shapes how we feel pain, stress, and emotion. This is why targeting substance P therapeutically can have wide-reaching effects, both positive and negative. In peptide research, synthetic forms of substance P have been used to study its effects on healing and regeneration. Some preclinical experiments show enhanced tissue recovery when substance P is applied to wounds or nerve injuries. However, because substance P also amplifies inflammation, these kinds of therapies need to be carefully controlled. Too much could cause harm, but the right amount could speed up recovery. There's also interesting data on substance P and cancer. High levels of substance P and NK1 receptor activity have been observed in certain types of tumors. Blocking substance P in these cases has been explored as a way to slow tumor growth or reduce metastasis. This is still an emerging area of research and not something used in clinical practice, but it highlights how widespread substance P's influence is in the body. Substance P levels can be influenced by various factors, including stress, injury, infection, and chronic inflammation. They can also be affected by lifestyle factors. For example, chronic sleep deprivation, poor diet, and ongoing stress may lead to elevated substance P activity. On the other hand, practices that support nervous system regulation, such as regular exercise, adequate sleep, and stress management, may help keep levels more balanced. Some natural compounds and interventions have been studied for their potential to modulate substance P. For example, capsaicin, the compound that makes chili peppers hot, can deplete substance P from nerve endings when used repeatedly. This is part of why capsaicin creams can help with certain kinds of nerve pain. By lowering substance P levels locally, they can reduce pain signaling. Peptide science continues to explore how substance P can be manipulated for therapeutic purposes. This includes both synthetic peptide analogs and receptor-targeting molecules. Because of its involvement in so many systems, from pain to mood to inflammation, substance P remains a key research target for a range of conditions, from chronic pain to autoimmune diseases to psychiatric disorders. Another interesting area of research is how substance P interacts with the gut-brain axis. Because the gut contains a large amount of the body's substance P, shifts in gut health can influence brain health and vice versa. This is one of the reasons why people with inflammatory bowel conditions often experience mood changes or increased pain sensitivity. Substance P can act as a bridge between the gut and the brain. Some research also suggests that substance P levels change with age. In certain tissues, they may decline over time, while in others, like inflamed joints, levels may increase. This may be part of why some age-related conditions, such as arthritis, involve increased pain and inflammation. Balancing substance P activity could become part of future anti-inflammatory or regenerative strategies. Substance P's role in wound healing is particularly promising. Studies have shown that it can stimulate keratinocyte migration, increase angiogenesis, and support nerve regrowth. These effects may be useful in chronic wounds or after surgical procedures. However, it's important to remember that these studies are often preclinical, meaning more human data is needed. In neurological conditions, substance P modulation could offer new therapeutic angles. Because it's involved in both pain and neuroinflammation, targeting it may support conditions like peripheral neuropathy, migraines, or neurodegenerative diseases. It may also be relevant in traumatic brain injury, where substance P release can amplify inflammation in the brain. Although substance P itself is not widely used clinically as a therapeutic peptide at this time, NK1 receptor antagonists and related compounds are being tested in clinical trials. These include potential treatments for depression, anxiety, chronic pain, nausea, and even some cancers. It's also worth mentioning that substance P plays a role in the nausea and vomiting reflex. This is why NK1 receptor antagonists have already been approved in some countries for treating chemotherapy-induced nausea and vomiting. This is one of the most established clinical uses related to substance P pathways. Because substance P is so powerful, Its therapeutic potential lies not just in increasing or decreasing its levels, but in precisely controlling how and where it acts. The same molecule that can worsen chronic pain in one context could accelerate healing in another. This complexity is why peptide research continues to focus on understanding substance P in greater detail. For individuals exploring peptide science, it's important to remember that substance P is not a typical supplement or a casual experiment. It interacts deeply with critical systems in the body. Any intervention involving this pathway must be approached with caution, research, and medical guidance. The body's pain and inflammation responses are incredibly complex. Substance P is a crucial part of that orchestra. It can make pain sharper, but it can also help the body respond and heal. It can amplify inflammation, but it can also help regenerate tissue. Understanding its dual nature is key to unlocking its therapeutic potential. This brings us to a larger point about peptides in general. Many peptides act as modulators, not just triggers. They don't simply turn things on or off. They fine-tune how systems behave. Substance P is a perfect example of this. It can push the system toward pain and inflammation or healing and recovery, depending on how it's balanced. In future medicine, substance P and its receptor pathways may become more targeted. Personalized approaches could allow precise dosing, timing, and location-specific delivery. This would minimize side effects and maximize benefits. That level of control isn't here yet, but research is moving steadily in that direction. So whether we're talking about chronic pain, gut health, emotional regulation, skin inflammation, respiratory function, or healing, substance P has a role. It's one of those key peptides that touches almost every system in the body. And as research evolves, we may find more ways to work with it rather than against it. This podcast is for educational purposes only. It is not medical advice. Always consult with a qualified healthcare provider before starting or stopping any supplement, peptide, or treatment. Thanks for listening, keep learning, and stay curious.